Welcome back to the second and final module of Psychology for Nurses. In the previous module, we explored how psychological knowledge enhances patient care across all stages of life and health conditions. In this module, we shift focus to the mental health challenges that patients, and even nurses themselves, encounter in the healthcare environment. We look at stress, anxiety, depression, altered mental states, and various therapeutic techniques such as cognitive behavioral therapy and motivational dialogue. Finally, we'll explore how psychological understanding helps nurses work effectively as professionals in a team, building resilience and emotional intelligence. Let's begin. Underscore 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 underscore. 8. Mental health in the nursing environment. Mental health is not just the absence of mental illness, it is a state of well-being in which individuals can cope with daily stresses, work productively, and contribute to their communities. 8. Mental health in patients. In nursing, you will encounter patients dealing with emotional distress, psychiatric illness, and psychological trauma. These issues often accompany chronic physical conditions such as cancer, diabetes, or cardiovascular disease. A psychologically informed nurse understands that a patient's emotional well-being is just as important as their physical state. Anxiety about surgery, grief over a diagnosis, or fear of isolation can all affect recovery and compliance with treatment. B. Mental health in nurses. Let's not forget you, the caregiver. The nursing profession is demanding, often exposing practitioners to burnout, compassion fatigue, and emotional exhaustion. Supporting your own mental health is essential to sustaining your ability to care for others. Promoting a psychologically healthy environment includes proper workload management, peer support, access to mental health services, and self-care practices like rest, reflection, and debriefing after stressful events. Underscore 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 underscore. 9. Stress and illness. Stress is a psychological and physiological response to perceived challenges or threats. While some stress can be motivating, chronic stress can be harmful to both body and mind. A. Types of stress. Acute stress is short-term and often resolved quickly. It may arise before a test or during an emergency. Chronic stress lingers over time, such as financial hardship, workplace conflict, or long-term illness, and can wear down both mental and physical health. B. Stress and the body. Stress activates the fight or flight system, releasing hormones like adrenaline and cortisol. In the short term, this can help in emergencies. But over time, high cortisol can suppress immunity, increase blood pressure, and contribute to chronic diseases. C. Psychological effects of stress. Long-term stress can lead to irritability, concentration problems, sleep disorders, and even depression. In the nursing context, patients who are stressed may struggle to follow treatment plans or engage with their care. D. Nurse interventions. As a nurse, you can help reduce patient stress by explaining procedures clearly, encouraging questions, promoting rest and relaxation techniques, providing a calm and respectful presence. Equally, you must also monitor your own stress levels. Use breaks wisely, talk to colleagues, and practice mindfulness or relaxation exercises. Underscore 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 underscore. 10. Anxiety and depression. Anxiety and depression are the most common mental health conditions worldwide. As a nurse, you care for many patients affected by them, whether diagnosed or not. A. Understanding anxiety. Anxiety is more than just feeling nervous. It's a persistent, excessive worry that interferes with daily life. Symptoms include racing heart, shortness of breath, sweating, restlessness, avoidance behavior. Anxiety disorders include generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. B. Understanding depression. Depression goes beyond sadness. It includes persistent low mood, loss of interest in activities, fatigue, changes in appetite and sleep, feelings of worthlessness or hopelessness. In severe cases, it may involve suicidal thoughts or actions. As a nurse, being able to recognize these signs is critical. C. Psychological support. Offer a listening ear without judgment. Encourage expression of feelings. Collaborate with mental health professionals where necessary. Support can include counseling, medication, peer groups, behavioral therapy. Even a brief, empathetic conversation can make a big difference to someone battling depression or anxiety. 11. Altered mental states. Altered mental states refer to significant changes in cognition, perception, or consciousness. These may result from illness, trauma, medications, or psychiatric conditions. A. Types of altered mental states. Delirium, sudden confusion, often seen in elderly or postoperative patients. Hallucinations, seeing, hearing, or feeling things that aren't there. Delusions, strongly held false beliefs, such as paranoia or grandiosity. Dissociation, feeling detached from reality or self. These symptoms may be temporary or chronic, and can stem from causes such as infections, substance use, brain injuries, or schizophrenia. B. Nurse's response. Stay calm and non-confrontational. Ensure safety, for both patient and others. Involve mental health teams quickly. Use grounding techniques, simple communication, and maintain a low-stimulus environment. Documentation of behavior and triggers is crucial in planning appropriate care. Underscore 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 underscore. 12. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy is one of the most widely used and evidence-based psychological treatments. Though nurses may not conduct full therapy sessions, knowing the principles of CBT can greatly improve communication and patient support. A core idea of CBT. CBT works on the principle that our thoughts, feelings, and behaviors are interconnected. Negative thinking patterns can lead to negative emotions and unhealthy behaviors, and vice versa. For example, a patient who believes, "I'll never get better," may feel hopeless and avoid exercise or medication. B. Nurses' role in CBT principles. Encourage patients to identify and challenge unhelpful thoughts. Set realistic goals. Practice positive self-talk. Use problem-solving strategies. Simple questions like, "What evidence do you have for that thought?" or "What would you say to a friend in your situation?" can help reframe negative beliefs. Underscore 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 underscore. 13. Motivational dialogue. Motivational dialogue, also known as motivational interviewing, is a patient-centered communication style designed to help individuals find their own motivation for change. A. Principles of motivational dialogue. 1. Express empathy. Use reflective listening to show understanding. 2. Develop discrepancy. Help the patient see the gap between current behavior and future goals. 3. Roll with resistance. Don't argue. Allow the patient to voice doubts. 4. Support self-efficacy. Encourage belief in their ability to change. B. Practical application. For example, if a patient is smoking despite a heart condition, instead of scolding, you might say, "What are some things you like about smoking?" What worries you about continuing to smoke? What would be different for you if you quit? Such conversations promote patient autonomy and build trust. Underscore 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 underscore. 14. Psychology and working as a nurse. Now let's look at how psychology supports the professional development and emotional well-being of nurses themselves. A. Emotional intelligence. This is the ability to recognize, understand, and manage your own emotions, and to empathize with others. High emotional intelligence helps in dealing with difficult patients, handling workplace conflict, maintaining professionalism under pressure. B. Communication skills. Psychological knowledge enhances listening, assertiveness, and nonverbal communication. Understanding that someone's anger might mask fear helps you respond compassionately rather than defensively. C. Team dynamics. Psychology helps nurses collaborate more effectively. Understanding personality differences, conflict resolution, and group behavior contributes to a healthier work environment. D. Resilience and burnout prevention. Resilience is the ability to bounce back from stress. Nurses can build resilience by setting boundaries, reflecting on successes, practicing gratitude, seeking supervision and mentorship. Avoiding burnout means recognizing early signs, like exhaustion, irritability, and detachment, and taking action. Self-awareness and self-care are not luxuries, they are necessities. Underscore 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 underscore. Conclusion of Module 2. This concludes our second module, and the entire course, Bond Psychology for Nurses. Throughout this lecture, we've examined how psychological understanding is essential in every aspect of nursing. From children to the elderly. From chronic pain to terminal illness. From anxiety to altered mental states. From supporting patients to supporting yourself. Nursing is not just a clinical job. It is deeply human work. By applying psychological principles, you offer care that heals not only the body, but the mind, spirit, and dignity of the person before you. Continue to learn, reflect, and grow in empathy and skill. Your role as a nurse is one of the most important in society, and psychology is one of the most powerful tools you have.